Judgments concerning causation. Judgments concerning causation should be based on scientific evidence and clinical rationale. A causal relationship is biologically plausible when 1. Is there a reasonable relationship between the injury, tissue damage, or diagnosis, and trauma, anatomically or physiologically possible? 2. Are the forces sufficient enough to cause the tissue damage or diagnosed condition in this occupant? 3. Is there evidence that traffic collisions are consistently or reliably associated with the claimed tissue damage, symptoms, or diagnosis in peer-reviewed literature? 4. Is the cause and effect contiguous in time? Signs, symptoms, or diagnosis should occur after the collision, temporal relationship. And 5. Is there specificity in the association between the diagnosed conditions and trauma?